So these rapid antigen tests are really a complement to the more traditional gold standard PCR testing. They are incredibly useful as a way of routine and regularly monitoring and trying to pick up COVID-19 cases. However, we do have to stress that they are never and will never be a replacement for PCR.
And when you say they won't be a replacement, is that in terms of accuracy in particular?
Yes, PCR is highly accurate. It's very sensitive and incredibly specific for this virus, whereas LFTs or rapid antigen tests are less sensitive, and certainly they are less sensitive at picking up asymptomatic cases. But what they lack in sensitivity, they do make up for in the ease of use, the cost effectiveness, and the rapid results that we get. So they do certainly have an incredibly important, very useful role to play.
Now, at the moment, the government is talking about them being used here once they do get, they've got approval, but once they start getting distributed with the help of a health professional. Is that what's been happening in Europe as well?
So the rapid tests here are actually used both by health professionals and as at-home testing kits. And what we have seen is that there is a difference in the sensitivity that we get depending on whether a medical professional conducts the test or whether it's done by someone in their home. And that is very likely down to following the protocol and also how likely you are to put the swab so far up your own nose. So we do get variations in results. However, they are incredibly useful. And certainly myself, I do home tests twice a week and have done since December. And that regular monitoring then is incredibly useful, that I know if I'm likely to be infected, I'll pick that up very early.
And also, I'd imagine it's been incredibly helpful for businesses getting back to some form of normal. They can have, testing on site, quick testing on site for their staff. And it means they don't lose workers, waiting for days for results.
Yes, absolutely. And not only for that routine testing every week or every 4 or so days, but also in terms of if there is a larger scale event, either a work event or a conference, or even in terms of large social events, these rapid tests can be useful to pick up those people that are most likely to be transmitting the virus. It won't catch everybody, and I think that's something we have to stress, but it certainly reduces the risk.
You talked about fairly cost effective. What are you paying for them if you're using them at home quite regularly?
So here in the UK, the tests are free for us. So we can actually go on to the government website and put in our home address, and a box of 7 tests is sent for free. Additionally, a lot of workplaces offer these tests, so you can just pick them up from your employer, or you can actually go to many pharmacies and collect them as well. So at point of use for us, they are free. However, this does vary around the world, and the costs do vary as well, depending on the manufacturer, really with an average cost anywhere from $5 to $20 US.
And that's a critical one, because I can imagine the take of them would really depend on them being cost effective if you're going to use them a couple of times a week.
Yes, these need to be incredibly cost effective to use in order to encourage people to use them. And that is really one of the keys. They have to be easily available, they have to be cost effective, and it has to be an easy protocol for people to follow. In fact, here we've actually started to modify some of the protocols now for people that find taking the swabs quite difficult. So for a lot of young school children that do rapid antigen testing, we're now only doing the nose swabs and not the throat and the nose, which some children do struggle with.
Yes, indeed. I can't imagine you ever get used to doing that testing. It's quite the most uncomfortable feeling to do, having it done, let alone doing it to yourself, I can imagine.
You really do actually get used to it. As I say, I've done 2 every week since December, and I very rarely sneeze anymore, which is a good thing for me. It never feels comfortable, and I think if you don't feel slight uncomfort when you're doing it, you're probably not doing it correctly.
You haven't done it properly. Well, great to get that experience, Lindsay. Thanks for joining us.
Thank you.